Going. All right. Good afternoon, good evening, good morning. Happy New Year. Happy 2024. It's great to see you all. I am in denial that it's already January 23rd. Classes started for us this week, so I teach a very large class at Hopkins, so my semester is underway. It came too fast. Oops, sorry, Jessica's sending me something to remind you all. Okay, sorry. So anyway, it's good to see you all and excited to be here. It just feels like it's been a long time, and so appreciate being here to connect with you all. I have missed you all. I had a chance to see Tevin actually. Recently, Tevin was at the writing retreat, so I had a chance to see Tevin live and in person. So that was pretty dope, and definitely miss everybody. So wanted to just begin by just saying welcome, acknowledging the space that we're in and the time that we're going to be in together for this next bit of your day. I also want to just acknowledge too, there's always a lot going on, and I hope that you are able to make time and space to take care of yourself, whatever way you need to. And if there's anything that I can do or the rest of the MPC, please reach out to us. Before we jump into today, I want to begin as we always do, which is with lifting up news, celebrations from all of you, good news, whatever you'd like to share in this space. So I invite you to come off mute, put something in the chat. I also acknowledge that Corey's here with us, so we'll be keeping an eye on the chat. But please, I invite anybody to share what you would like. Yes, I want to celebrate. Yes, that other half of the scholarship came through. We celebrate that. And I'm glad to hear that. I mean, I know everybody's money. Actually, this is an important point to mention this. So thank you for naming that. I know everybody's money is distributed differently. If you have any issues with getting your money, reach out to us. The foundation gives each of your institutions the $30,000 in September after we sign everything. And then they distribute it. And some people get lump sum, some people get monthly, some people get bi-monthly, whatever it is, you should be getting your money. And if for some reason you're not. So we celebrate, and I see all the hearts for everybody who's got the rest of their funds from HPRS through the Robert Wood Johnson Foundation. I hope that there aren't any issues, but again, if there are, reach out to us and we are on it. It's amazing how many institutions play around with people's money. So we jump in very quickly to resolve that. It is a shame. So if you're having an issue, please know you're not alone. Reach out to us. We will advocate with you to make sure you get what you are due. And that's for your entire time you're in this program. Sometimes they try to raise some things after your first year. So I just want to name again, reach out to us. But I celebrate that. Thank you for lifting that up. That is definitely great news today. Nice, Christian, congratulations. We celebrate your poster. Were you at TRB? I can't see you on my screen.
I was at TRB.
Oh, awesome. Love it. Awesome. Congratulations on your poster presentation. That's great. And I was at TRB. This meeting that Christian's mentioning actually was had, I think, about 14,000 people at it. It was in DC at the convention center. So it's the biggest transportation conference in the world. So that's dope, Christian. Congratulations. Congratulations, Alex. Sophie coming up already. Oh my goodness, in March. Congratulations on that. That's awesome for your two presentations. Pursuing a master's in human machine interaction. Oh, that is so interesting. I love that. Congratulations. And the first student in your university exploring that. I would love to learn more about that. That sounds really interesting. And to get that alongside your doctoral degree. So thanks for lifting that up. That's excellent. Lots of good stuff happening. So the manuscript accepted for journal LGBTQ youth, waiting and proofs. Congratulations. These are things to send to the HPRS box, hprs@jhu.edu. We want to celebrate you. If you're comfortable, especially new papers, we share those out. Please send things. Somebody said to me recently, I don't want to brag. I said, it's not bragging, it's just facts. Just facts. Celebrate what you're doing. Always remember that. All right. Paper to share about our research team's year-long partnership. Okay, awesome. Congratulations. It looks like that's out. Make sure we know about that so we can amplify that. And yes, this is an impressive community. I hope that you find encouragement from this space and this group, and you see how much people are just supporting each other. I want to name that and celebrate that. And even if you've decided not to share today, that is okay. I hope that you know and celebrate the things that you are doing, and that we celebrate all accomplishments, whether it's finishing an assignment, finishing a paper. I'm big on celebrating progress, so I want to lift that up as well. NAMI, yes, final stage is solidifying nomination. All right, to run for the National Board of Directors. Congratulations. Leading into leadership opportunities. Congrats on that. That also makes me think about something that you'll hear more of as you go through this program. We as a community, as the National Program Center, we are available to help support people preparing for presentations, dissertation proposals, interviews. We rally and get together for dry runs or things like that. So if you feel like you have a presentation, you like to practice it on some people, we do those all the time for the MPC. So reach out to us if you feel like you want to practice or even practice interviewing or things like that. Reach out to us where we are available. We celebrate the 2 classes this semester. Yes. Lifting up, not overcommitting yourself. And I hope that means you're also making a little bit of time for restorative rest. It's nice to be able to have the choice of taking fewer and not overcommitting yourself. We celebrate that too.
Hi, friends.
Great. Hello.
I'm celebrating back to healthy eating. I gained like 20 pounds throughout this PhD program. And every time I write a paper, I'd eat, think about writing a paper, I'd eat. So now I've been able to make my own salads and just be more intentional about eating and not center everything around food. And hopefully that carries on throughout the rest of the year.
Well, we celebrate you. Thank you for sharing. Congratulations. All about taking care of yourself. And I definitely hear that. Celebrate having healthy relationship with food or healthier. Congratulations. And yes to wellness for sure. All right. I'm not seeing anything else I missed in the chat. So again, I celebrate everybody. Congratulations. Thank you for sharing. Again, it's great to be with all of you. January, welcome back. I'm gonna share my screen and just jump in with a few reminders before we start our time together and go through some content. Let's see. We also want to celebrate our, we have our live transcription is on, so we have live captioning. If you're having any issues with that, let us know. Hopefully everything's fine. Right, okay. So I wanted to just begin by reminding you of a few upcoming events or opportunities. The first is we do financial literacy workshops, and you might say, Keisha, why do y'all do that? And so for me, this is really a personal thing that we do. I grew up in a low income family where nobody ever taught me financial literacy. Never learned anything really about credit, about a number of things. And so a few years ago, we connected with a colleague who has really been one of our partners for HPRS and does annual financial literacy workshops for us, and spends a lot of time talking about mostly doing that first session on taxes. Because you know what, a lot of HPRS scholars will reach out to us about their taxes, because some of you, your taxes come out of your stipends, others, you have to make estimated payments. And so in order to provide more increased awareness and knowledge, we have our contact, Shahar, again, who we've been working with for several years, who does that session for us. And then he also has done additional sessions for us over the years. And so Shahar is doing 3 sessions in February. The first one's on taxes, again, how you sort of think about taxes when you're a full-time student. The second one is on managing student loan debt and sort of becoming a little bit more aware about some of that. And then he's doing a new session for us this year on managing finance during economic volatility and uncertainty. And these are topics that people in our community have asked for. So that's one thing. We are very responsive. Like if people say, oh, we really like a session on this, and especially if we're hearing that from a number of people, we will do what we can to provide that content. And so we, for the sessions that Shahar did last year, he does a survey, brief survey at the end to ask for additional sessions. And these are the ones that have been lifted up. So again, I hope that you're available to attend. They will be recorded for those of you who aren't able to make it. But he is so good. He puts the information in a very relatable way. I remember one of the things he's talked about from the very first time is, you know, he emphasizes saving, and people are like, I can't save, I only have an extra $5 a week. And he's like, if you save that $5 a week, this is how this can grow. Again, another part of financial literacy that I know in my family, we just didn't talk about that. I mean, you know, God bless my parents, were just trying to pay the bills. They weren't talking to us about saving and other things. And so we hope that you take advantage of this resource. The second thing I wanted to lift up is that in March, we have a spring gathering. And again, this is something that we started to do as like a touch point in the spring. It's virtual. It's over 2 days, and there'll be a number of events. One event that's required for this as part of our year is the policy panel. We had one in the fall. There's another one being put together. So that will happen on March 7th. And so this, if this hasn't come out already, these will be going out tomorrow, I think, with the dates and the times, the exact times on these dates. But across these 2 dates, we have a couple of book clubs. And speaking of, we also put a call out for anybody who wants to co-facilitate book club. We've had a few scholars raise their hand, and so I invite folks from cohort 7, if you're interested in co-facilitating one of the book club sessions, they'll occur over these 2 days. We also have our policy panel that I just mentioned. There's also some virtual networking sessions across all four cohorts. And then we also do a town hall with the Robert Wood Johnson Foundation. So our main funders, and I really encourage you not to miss any of it, but that one especially, where the funder and the people who really are behind our program come in a space where they provide some updates and answer your questions. And so for anybody who's sort of interested in seeing how philanthropy approaches our program, I encourage you to come to that. And finally, I'm really excited. You all may have, actually, I'm trying to think if you have heard about, actually, I don't think we put a call out for this, so you would not have heard about this, but the other thing we're doing is we are releasing 2 teach outs. And so has anybody ever heard of a teach out? Let me stop sharing my screen and see for a second. Has anybody heard of a teach out? Yeah, I see a few nods. And so one of the things we do is we provide lots of opportunities through HPRS. And one is for you all to propose and to put on a teach out. So a teach out is really a way of educating the broader world public community on an issue that you care about over a few brief sessions with a call to action. And so each year we put out a call for ideas for a teach out. We provide dollars for that to cover your time. People do those with community partners, and we're able to give some funds to the partners. At Johns Hopkins, we have a group called the Center for Teaching and Learning, and they help produce these teach outs. And I tell you, they have been fantastic. There was one produced a couple of years ago by a scholar in C3 on Black urban farming, and our team at Hopkins sent out individuals to actually go to Philadelphia where the scholar was and actually record farming, record community. So we've also had a variety of teach outs, one on immigration where the scholar was recording stories from individuals in the community. So it's really a way to help unpack an issue and to, again, have a call for action. Like, what can people do after they've learned about a topic? And so we have 2 of them being released in March. They are both excellent. And I hope that you'll be able to check that out. That's right after the town hall, which is on that Friday, March 8th. Again, there'll be an email going out soon with all of these events. I encourage you to check that out, especially if you're intrigued to do your own teach out. There'll be a call coming out later this year for ideas for a teach out. And we encourage you to learn more when that comes out and to think about if you want to do that. All right, so let me go back and go back to the screen. So the other couple of things I want to remind you about are the Summer Institute. I can't believe I'm saying that. It's 6 months away already. Time is flying by. So the week of June 23rd, all 4 cohorts for the first time ever will be in Baltimore. We haven't had 4 cohorts yet active at one time. And so we are doing this Fall Institute in Baltimore. And again, it's really exciting that all 4 cohorts will be together all week. There's an active planning committee that involves scholars from every cohort year. You all will have a chance to actually connect with leadership coaches who you'll be connected to during the next year. They'll be there in person. Our national advisory committee will be there in person. So again, there's a lot going on. We're going to have I appreciate the link to the Orioles, one of our O's game at the Fall Institute. Yes, you have already named that. There will be, we will have an opportunity for anybody who wants to go to a game to go. Camden Yards is a beautiful ballpark. I'm a New Yorker, I'm a Yankees fan, but I love going to Camden Yards, especially when the Yankees are in town. It's a great ballpark. And there will be an opportunity to have a meal at the ballpark and then to go to a game if anybody's interested. So again, and the hotel we're staying at is actually right across the street from Camden Yards, so we're right downtown. So I wanted to just remind people that put that on your calendar. This is a required event. Again, this is the time where all 4 cohorts will be together in community. And so we're really looking forward to this. And we've been working hard since the fall to put together programming for that. And finally, I mentioned a little bit earlier about your grants. If you need any administrative support, Gregory Powers, who's the deputy director, reach out to him, reach out to me, reach out to the box. We're here to support you. Please don't sit in crisis. We are a community, and sometimes we think we're by ourselves and have to solve all of our problems by ourselves. I'm here to tell you that is not the case. We are here for you and to support you. So please reach out if we can be helpful. Let me pause and see if there's any questions about anything I just shared before we jump in and sort of remind ourselves of where we've been and then move forward to where we're going to go over the next few months in our time together. I'm not seeing any hands and I don't see anything in the chat. And so if I missed it, if I missed you, please speak up now.
I just
Or-
wanted to say that
Yes.
I don't know how many of you have already met with Jessica, but it was to talk about values, but I had mine and it was just really, really wonderful. And so anyways, for any of you who haven't done it, it's something to look forward to. This is off topic, but I just felt like I needed to share because she really brightened my day. So yeah.
Thank you for naming that. Not off topic at all. And that is a great reminder from Jessica. Jessica will be with us during the next session to do the last session in our values. And Jessica wanted me to remind you all, if you have not yet scheduled a meeting with her, please do so. And if you have not turned in your values that she asked you to complete, please do. She's still missing a number of them. And so if you can't find that, reach out to me, and we'll be sure to make sure that you have that. But please, there's a place in the portal to upload your values, and yeah, it's having Jessica on our team is a blessing, and I convinced Jessica to leave her other position and come be with HPRS full time once we got this program. And so that was one of the best decisions I ever made in terms of hiring. And so I just, she's been an incredible resource. And really what we're going to see too is this shifting of thinking about our values as it relates to the work we do and the spaces we do around policy. And then we'll continue to lean into leadership throughout the entire time we're in this program. And so we'll spend more time with Jessica this summer and start to focus on our strengths. As I mentioned, we have leadership coaches that you will have an opportunity to work with. So again, more to come on that, but thank you for the plug for Jessica, Sunyoon. Appreciate it. I see Yui, I did right before this. It was so special. Awesome. Thank you. Thank you for naming that too. So yeah, please reach out to Jessica if you haven't already and submit your values. So thank you for that. All right. All right, very good. Well, let's pivot back to the slides. Just really just to help me organize thoughts in terms of what we're going to talk about today. Sorry, I am on my, oops. Sorry, let me go back and share again. What's going on here? All right, let's try that one more time. Okay. So I want to just take a moment and just remind us of where we've been over the last couple of months. You know, we talked about Jessica coming to us to talk about values. She was with us for a few sessions. We also talked about what does it mean in terms of building a culture of health. We learned a little bit about the public health system and healthcare. And really when I wanted to just show this image, because this is the image that was part of the call for proposals. Actually, let me remind you that right now, actually call for proposals for cohort 8 is open. If there are any fellow doctoral students at your institutions that you think would be great for this program, please encourage them to apply. We will, applicant webinar is actually tomorrow for that, and then applications are due in March. But again, we are looking forward to putting together cohort 8. So we wanted to name that. But again, so this image should be very familiar to you all. It was in the materials, it's on the website. We talked about this. This is the Culture of Health Action Framework that the Robert Wood Johnson Foundation put forward when they decided that the efforts that they had been investing in really weren't making the kinds of impacts that they were hoping for, right? So much of health in this country, the metrics we continue to have high mortality from a number of preventable conditions. We continue to have low life expectancy, lots of health disparities, inequities, and the foundation back around 2013 or so said, we have to really do things differently. We have to think about building a culture of health. And when we think about a culture of health, through a lot of listening sessions and lit reviews and expert consultations, they came up with this model where there are these 4 areas, these action areas around making health a shared value, fostering cross-sector collaboration, creating healthier, more equitable communities, and strengthening the integration of health services and systems. The middle of this has the goal of improved population health, well-being, and equity. And around the outside of this image is equity to demonstrate or illustrate that equity is all-encompassing. And that in order to make progress in any of these action areas, we have to be thinking about equity, and equity broadly defined with a strong emphasis on racial equity, thinking about a number of other equity goals as well. How this connects to HPRS is that for all of us, you are coming from different sectors, from different disciplines, and there's a role for all of us to play. This program, Health Policy Research Scholars, is really designed to help amplify and bolster your skills and your knowledge and your comfort with policy. And why does that matter? It matters because policy is everywhere, and I'll talk about that in a little bit. To sort of get us grounded for where we're going to go this spring, and to really think about policy. And I want to name that some of you in this space have taken policy courses, have been in this, doing this work, and so have knowledge, and I invite you to bring that to this conversation. We all have experiences that are valuable, and there are places where different experiences are maybe more relevant to bring up to a particular topic. So today, I invite anybody who resonates with the work that what I'm talking about in terms of your experiences. I invite you to bring that to the conversation. All right. So I want to just say, well, where are we going this spring? And so I'm going to start today with a bit of an overview about policy, just to get us all on the same page. Jessica will be with us next session to do the final session of values and sort of how that relates to this work. And then we're going to spend some time talking about different aspects of policy. So my colleague, Don Warren, who runs our, who co-directs our Center for Indigenous Health at Hopkins, and is a friend of HPRS, he's going to come and talk about how do we think about American Indian health policy and tribal health policy, and what does that mean, right, as we think about policy in this country. I'll be back up and talking about framing problems and problem definition and problem policy solutions. We'll talk about different ways to identify policies. My colleague and one of our other faculty for HPRS, Jan Vernick, will come in, who's a public health lawyer. We'll talk about the role of the courts in health policy. We often say that the courts themselves don't make policy like a legislature does, but their decisions absolutely inform policy. We see that all the time. And so we'll unpack that a bit more. And then we'll have our own Corey DeCinto, our TA for this class, who's been so valuable to me and to this journey, come and talk to us about health economics and policy. This is Corey's area of expertise. And so how do we think about health policy and health economics? And then we'll spend some time talking about policy engagement, which is one of my loves. I've been engaging with policy for a long time, and I'll talk a little bit about my journey in a moment, but also bring that to this space. And then one thing that you will all have to do is actually draft your own problem statement. And so and I'll say more about that. And I say that it is brief. I'm talking about like 50 words. So don't panic. This isn't like a paper. This is a problem statement on a problem of your choice. It could be something you've been working on, could be something different. That is going to form the crux of a policy memo that we'll revisit when we're together this summer. As we think about a way to communicate with various end users. We often suggest and recommend that you actually write a policy memo that you send to a policy maker or some person who's the recipient of that. And we've had a number of scholars throughout the years who've sent their memos to staffers or legislators or the school board or whatever it is based on where they're working on the policy. So good times coming. This should be fun. I look forward to being on this journey. And so today what we're going to do is, again, just sort of talk by what do we mean about health when we say health policy. And I'll provide a few resources. I'll post those on the portal after our time together today. I'll also post these slides and let's talk a little bit about some theories, and there's lots of theories out there. I want to name that. We have, like 45 minutes. I'm just going to give you a little bit of overview, talk about a couple of things. Again, invite you all, if you have things to share, to come into this conversation, and know that we will revisit some of these things in the future. And then we'll talk about some theories relevant to health equity in particular. So I wanted to begin by just telling you a little bit about my journey in policy and how I came to this space. And so for me, I did my undergraduate training at Tufts University, where I majored in sociology and community health. And I had a chance to take a number of public health courses when I was an undergrad. And so this was in the late 90s. I graduated from college in I went to college in 1996 and graduated in 2000. But in that time, public health wasn't a really big thing. Like, it wasn't like a major. It was very rare that you were taking public health classes as an undergrad, as opposed to now where it's very popular. I, right after, went and did my master's of public health in chronic disease epidemiology at Yale School of Public Health, where my interest in epidemiology and policy was really fostered. I was, applying these really rigorous study designs, looking at health disparities, particularly for cardiovascular disease, and kept asking, well, what do we do with this information? How do we change things? That, combined with taking a policy course from one of my mentors, Mark Schlesinger, really got me thinking about the intersection between epidemiology and public policy. And so then I was like, well, I want to work in the policy space. And so I applied for my doctoral programs, and I applied for programs in epidemiology and in health policy and management. And I ended up going to the program that in the department that I now have the privilege of chairing, which is really fun. I sort of grew up in this department, and here I am as chair. And really what I was doing, I was looking at programs in applied epidemiology as well as policy, wanting again to take the science, the evidence, the research, and translate it and do something with it. And I understood the potential for policy to really change things broadly. And I'll define what I mean by policy in a moment. All right. And then, so I finished my degree at Hopkins, and one of the things that I want to just name about my degree at Hopkins is, while I was doing my classes, I actually was an intern. I was also a legislative intern with the Maryland General Assembly. So in my program, we actually had an elected official who was an adjunct faculty, and we spent the day in Annapolis sort of shadowing him, looking at what was happening with learning about the state and Maryland and policymaking. And I was hooked, and I was really excited and interested in asking a lot of questions about, well, how do you think about research and science, and how does that inform your decision making? And Delegate Morheim, Dan Morheim, actually offered me a position to come and work on his team. And I remember that part of that involved all of the politics, right? Like, he was up for re-election. And so I can't tell you how many campaign events I went to. I walked in a lot of parades, like all of the stuff you do to help somebody get reelected. And so I worked on his campaign, and he was reelected. And then also had a chance to spend time during the legislative session where I was his aide, writing things like policy memos, meeting with constituents, surveying constituents, going to events in the community, representing him, and then also bringing research syntheses to him and his committee for issues that had implications for health. That experience was really life-changing for me to be able to do that while I was working on my dissertation. And so I would work on my dissertation and drive to Annapolis a couple of days a week and spend time with Delegate Morheim and his aide and anybody else. And it was really great to see how science is used and not used in the process. And it was just important to be on the ground and to see that. And then when I left, when I finished school, went to actually the Robert Wood Johnson Foundation and worked there. So I was in New Jersey, the foundation's in Princeton, and I worked on the childhood obesity team and what was called the vulnerable populations team at the time. And then for a number of reasons I could talk about another day, I went on the job market and had an academic position at my institution at Hopkins. And when I joined the faculty in August 2006, Delegate Morheim invited me to come back to work with his team, and then also began to do work at the local level as well. So did work in Baltimore City with the Baltimore City Council on a number of local ordinances, and also worked with the private sector. Because when we think about policy, business is engaged in policy making all the time. And so I had a chance to get these different experiences. These really shaped me. I mentioned local Baltimore City. This is just an image, and we'll post this from a paper we wrote after Shannon, who is with HPRS, and another colleague wrote after the 2016 election, where we were very concerned about what was going to happen at the federal level around policy, and really took that as an opportunity to remind everybody of the importance of local policies as well. So when we think about policy, we're not just talking about Congress, we're not just talking about the Supreme Court, or not just talking about the executive branch and the president. Remember, your communities, where you live, local policies matter. And many times that matters even more for our day-to-day lives. And so we wrote this paper to say, yes, things are a mess, maybe going to be a mess at the federal level, but let's not forget about the importance of policies. And we wrote this paper called, Go Local, reminding people of the importance of getting involved at local policy change. So just to make sure we're on the same page, again, wanted to just do a little table setting about policy. And this table is from a paper that I led several years ago now, where we were asked to write a paper about sort of what do we mean when we talk about policy and Policy 101. There were lots of articles out there applying policies to a particular sector or topic, but there really wasn't a paper that was like a 101 out there at the time. And so we went ahead and two authors and I, who I invited to go on this journey with me, we put this paper together. And this table just summarizes what most of the different types of policies, and I say most, and I'll come back to that in a second. So what we're seeing here is these are just some examples. And so along the left side of the table is the policymaking body. So this is what I said just now. Policies can be at the federal level, at the state level, at the local level. And then we have these non-governmental private or institutional policies. And then we think about the type of policies, right? We can have legislation, things created by Congress, for example. Or you can think about, I mentioned the Maryland General Assembly, that's all legislation. And then there's this really important role for regulation. Has anybody ever been to regulations.gov? Have you ever gone on that page yet before? Anybody ever heard of that? No? This is something that I'll teach you about. So the government, the federal government. Oh, actually, does somebody raise their hand to say that they've
Yeah, I
been?
was just saying I've been on regulations.gov a few times for different classes at UIUC.
Nice, thank you. Thank you for sharing that. And I see you, we said the same thing. Any insights you want to share about that? Or did you find, how did you find it? Some people think it's, are curious that there's this place that has regulations listed.
I think it's fairly easy to navigate. They offer different posts every, I think it's like quarter or something like that for comments, like public comments on different regulations for people to kind of provide insight, concerns, and how some of those regulations can be further refined. So I find it to be a useful piece of information for sure. But of course, I think with supplementary research and support, it can be more beneficial for policymakers, but also residents and those who will be affected by the policies themselves.
Yeah, thank you, John. I appreciate that. Yeah, absolutely. I think it's I think a good resource. And why I mention it is that when we think about regulatory policy, particularly at the federal level, there is an opportunity for you all to have your voice heard. Right. And so there will be regulations that will be proposed. Sorry, my screen is acting up right now. There'll be regulations that are proposed and they will be on this website of regulations.gov, right? And you can go on there and look at regulations and you can comment. As John just said, there'll be a time for open comment period. I'm going to stop sharing for a second and figure out what's going on with my little thing here, and go on for open comment period and actually write comments on different regulations that are being proposed. And why this is so significant is that somebody's job is to read all of those comments and to review and to respond. And I have examples that I'll share where we've submitted things that have actually been part of regulations that have come forward. And why this is so important is that once we have a new law, it needs to get implemented. And a lot of those laws delegate responsibility to an agency to come up with the regulation. So thank you, John, for putting in the chat. So if you haven't been on that before, go check it out. You can check out that website. There's opportunities for you to just kind of peruse. You can search for a topic you do work in, see if there's anything out there. And that might be another way for you to engage in the policy process. One thing that I want to share too is that how you decide to engage is personal. Some people might respond to regulations on this website. Others may write a policy memo. Others may work with a community organization that's engaging with policymakers and doing visits. And through this program in the past, we've done Hill visits where scholars have an opportunity to actually speak with elected officials and staffers. Again, there's so many different ways. And so what we're showing you is this one way to engage. So again, thanks, John, for putting that link in the chat.
I just wanted to share one quick thing about how real this is, because how I got familiar with this site is because the Dietary Guidelines for Americans, which is basically kind of like the advice that SNAP programs or school lunches follow is based on this dietary guidelines for Americans, or DGAs. And so part of the part of the process of how, what children are eating in school and things like that comes from that DGAs. And we do have an opportunity to write and say, no, this is what I think about what my kid should be eating and things like that. So it really touches life. I have wondered though if these are actually read by somebody.
Yes.
But
Yes, Yui, they are read. That is somebody's job. Like, that is part of the law. Somebody has to read them and go through the comments. Absolutely. Absolutely. I'll share too, as an aside, I worked with a doctoral student once who was looking at a federal law related to food safety. And as part of her dissertation research, actually did narrative coding of all of those comments for data. So I lift that up as another method for your dissertation, where if you're looking at a federal law or a regulation, I should say, that's actually data. All that stuff is public. All of those comments are public. And so I lift that up for anybody who's in that space. Oh, Jasmine said I used to read these comments for EPA. Oh, and I'm wondering about the emoji you put there. And if there's anything you want to say about what you did, but that is proof, right? Like, they get read. I don't know if you have a comment on that, Jasmine. Anything you want to share with anybody who hasn't been on your side?
Yeah, just from the other side, I mean, it's definitely a lot of work, but it is like humans reading them. And I guess the kind of weird part too is I was like fresh out of undergrad as a consultant for EPA doing this work. So I didn't think I was the most qualified to like really synthesize them, but it might be a fresh college grad doing it. So just heads up.
I appreciate you naming that. What a great experience. And yeah, pulling those themes out and then responding to those. Yeah, appreciate that work. That is a lot of work. And Alex, I'm seeing that you've done it. You've used it when doing bill analysis in your current role to get insights at the federal level. Yeah, absolutely. Appreciate that. I don't know if there's anything else you want to say about that. You're welcome to or not. I just want to acknowledge the comment.
Yeah, during like right now, so for those that don't know, I work in like state level mental behavioral healthcare policy, everything from access to creating programs that make it easier, specifically at the intersections of like chronic homelessness and criminal justice system involvement to do that. And for the last few years, the healthcare authority here in Washington State is really trying to be a lot more innovative, especially since practically dismantling and deconstructing all laws related to controlled substance and counterfeit substance possession. And we've been looking at a lot of different proposed bills or bills at the federal level that we could perhaps adopt some parts of at the state level. And that's proved to be kind of fruitful sometimes too, especially when we're trying to create programs based off of a pre-existing foundation and trying to slowly scale it up so that it's accessible throughout the state. So.
Great. Thank you so much for lifting that up. And certainly one of the things we'll talk about as well is the value of looking at other states. It's one of the things I wanted to lift up. If you are involved with a policy in one jurisdiction, we often look to see what's happening in other jurisdictions, whether it's legislation, and there are tools to search for that, or regulation, even at the state level, as Alex noted, looking to see what's happening at the federal level. So again, we'll have a chance to practice with these tools and to really dig into them, just so everybody's aware. Again, it may not be part of what you end up doing in your day-to-day, but just again, for awareness, as you're thinking about the types of change, I find it really, I'll come back to this a little bit later, but one thing I find people are often challenged is in thinking about, what are the types of, what are the specifics of that bill? I've worked with bill drafters, and oftentimes, we will go to other jurisdictions to figure out, what's that language, or what are the provisions of that bill looking like? And again, a lot of that is learning from other places. So thanks to everybody who shared there. So I'll go back to this slide here. And I said, example includes a lot of most of the different types of policies. Again, these were some examples. That paper, we didn't talk about tribal policy making, understanding that there are over 570 federally recognized tribes, and that tribal governments maintain the power to determine their own government structures and laws. And so this is partly why we have Don coming in. He'll talk a bit about this. What does this mean as we think about working with tribal communities and indigenous populations about policy change when there are tribal governments that are responsible for their own policies. And so we'll talk about that with Don in a few weeks. On that paper that I mentioned, we put forward also to some principles for effective public health policy change, right? So we laid out, well, this is what we mean by health policy, and also acknowledging that we're not talking about healthcare, right? And so we can be thinking about Medicaid, Medicare, we talked a bit about that, heard a bit about that in the fall, but what we're talking about is sort of broader health policy and public health policy in particular. And so in this paper where we are referring to policies to address things like mental health, obesity, nutrition, we put forward one principle, which is using evidence to inform policy, right? And so we know the importance of politics and I would say evidence, and it's particularly challenging now in a time where people are questioning evidence, where people disregard evidence. We saw that so much during COVID. And some of that is, I could say, is on people who were communicating things in a way that wasn't accessible and clear for people to understand. Also acknowledging, though, things were changing rapidly. But one thing that we feel is critical, and I encourage all of you too, is to be thinking about what's the science around informing the policy. And what happens when we don't have enough science? How do we make decisions there? And there are a number of things to consider in terms of urgency or harm or a number of different factors. We also put forward considering health equity and name specific tools to allow that to occur during the policy process. And I'll talk about some of those tools, tools like health impact assessment or racial equity impact assessment, things that I use in my work. We also talked about the importance of designing policy with implementation in mind. And so oftentimes we will see a law that is signed and people haven't thought about the implementation. So one example of this is I worked on a bill once in Maryland related to closing the booster seat loophole, what was called at the time. And so there was a state law that required kids up to a certain age or weight to be in a booster seat when they were riding in the backseat of the car. The way that the law was at the time, it did not go up to the federal standards. And so we worked with a legislator to pull together the science, to write the policy memo, to get this out there, to testify at the hearing. And ultimately, this law was changed where it was actually consistent with the federal guidelines. And then, as you can imagine, I'll ask you for a moment to think about, when we think about implementation of a booster seat requirement law, what kinds of considerations do you think somebody would need to think about if we're actually going to move this forward, right? So we have a new law that says you have to be in a booster seat. When we think about implementation of something like that, what kinds of considerations do you think are important as we're thinking about that? Economic accessibility of booster seats. Absolutely. That was like the #1 thing that came up. Can parents afford this? Yep. Anything else? And for anybody who's ever tried to put a car seat in your car or a booster seat, training. Yes, exactly. Training for installing booster seats. Do people even know how to put them in their car correctly? Do people even know which ones to buy? Like, how do you decide? There's so many on the market. These were the top ones that came out. I'll say one more. It was interesting. So oftentimes after, particularly at a state, during the legislative session, a bunch of, when bills when the legislative body approves the bills, they get signed by the governor, there's some effective date by which that law becomes effective, right? Well, then they can start to be enforced. there was minimal communication about this. There was an article in the paper that was like, so, you know, Happy New Year, here are all the new laws that take effect today. And people were not prepared for that. Right. So there was the lack of communication about the new law. And so again, these are the types of things. So again, awareness, training, economic access that is important to think about as policies are being designed, because then you can proactively be thinking about implementation versus being more reactive and then having to rely on something like enforcement, where we don't need enforcement to address this problem. We need to ensure people have access to the right types of booster seats and know how to put them in. So that's just one example of something I worked on when we talk about thinking about policy implementation when we're designing policies. And then the fourth principle we put forward was using proactive research policy translation strategies. And what does this mean? It means those of us who are conducting research, designing ways and pathways to share that information with community, with advocates, with policymakers, with their staffers, and having a loop where those individuals also reach out to us. I have developed relationships with various policymakers where now they will call me to say, Keisha, we have this thing, can you come and testify? And that's the kind of relationships we want. Or, you know, do you have evidence about this thing? So again, so we want to be sort of pushing things out and also be there to receive feedback from those partnerships. All right, so I wanted to just talk a little bit about the policy process, and there's lots of models out there. This is one. You might see the policy wheel. Oftentimes, this is one sort of depiction of that, where we sort of talk. It really sort of starts with what's the problem, and we'll spend some time talking about what is the problem that you care about that you're trying to solve. And then you'll hear me say many times, what is the problem beneath the problem? Because oftentimes we see an issue and we think, well, that's the problem, right? So somebody might see an unhoused person and think, oh, that's the problem. The problem is that we have unhoused people living on the street. But is that the real problem? Is that the real problem? The real problem could be lack of affordable housing. The real problem could be lack of treatment facilities for getting or getting supportive housing or whatever it is, right? So we're going to unpack this, where I'm going to ask you to think about what is the problem you're addressing and what's the problem beneath the problem. And you'll hear me say that several times, because when we can specify the problem, we can then think about what are the solutions that we need to address. And so this particular model, the policy process, you know, goes through alternatives and analysis, recommendation, sort of thinking about the politics of it, implementation, and then how do we evaluate the policy once it's passed and enacted, and then implemented to look at, you know, its impact. Here's another model. I like this one. This is from the U.S. Centers for Disease Control and Prevention, and this is the policy process, and one that I lift up in my work many times. Again, where we sort of start with the problem identification. That's number one. And then you go through different tools to analyze the different policy options. You're then moving into policy development, enacting that policy, and then implementation. Again, this particular model, I like it has evaluation throughout, like inside that inner circle, because evaluation is present at all of these various steps. It's not just something that's a discrete part of the process at the end. You can be evaluating policy options. You can bring evaluation into implementation, a number of ways that evaluation shows up. And then this particular model has stakeholder engagement, broadly defined, stakeholder being the policymaker, community member, a number of different individuals, whoever has a stake in that particular policy we're talking about, and then also education. So how are we educating people on the policies? How are we making sure people are aware of what's happening in their communities? So I want to mention just a few leading policy formulation theories. And again, this might take people back to their government 101 or policy 101. One of the, I think still to this day, one policy that we often teach in our courses, for those of us who teach policy, is John Kingdon. This is the cover of his book, Agenda, Alternatives, and Public Policies. I learned from this book, early iterations, when I was a doctoral student. I'm sure there are people in this Zoom room who can say the same. And it really just talks about how policies are made, from Kingdon's a political scientist, but it's really for society as a whole, and really thinking about how do we identify our goals, what is involved in policymaking in the process. And we'll talk more about this. I'm not going to sit here too much today, but just want to mention that there's this theory called the multiple streams theory that, again, we'll come back to. And in that, and basically Kingdon talks about how you have these various streams that come together. And then we sort of look for these windows of opportunity when something happens where we can actually move a policy forward. And he talks about the important role of policy entrepreneurs. And again, we'll unpack this and define these things, but just wanted to introduce this and Kingdon and say that to those of you who are unfamiliar with Kingdon. We'll come back to Kingdon. But again, I think one of the things that's important is that this theory has been applied to so many problems for decades, and it always holds true in terms of having some problem, having a policy, having politics that influences that, I think, and then having these policy entrepreneurs, and then looking for this window of opportunity where those streams will come together and then something will actually move forward. Now, the challenge here is that this is really messy. This is an image from a book by Buse and colleagues that just talk about when we sort of visualize this, like we have like the problem stream, the policy stream, the politics stream. And a lot of times the three streams aren't coming together, right? And so you need that sort of policy entrepreneur, that person to sort of help move things forward, or that group or advocacy group, and then the window of opportunity is open. And I'm sure you can think of a number of problems in our society where we've seen a clear problem, clear policy, and then we see politics and it's still that they don't converge together. I think the issue of gun violence is just, you see this all of the time, how despite having these three streams coming together, having a window of opportunity after some massacre, for example, things still don't move forward. When Jan Vernick comes to talk to us, who's a public health lawyer, one of his areas of expertise is in gun violence and gun violence policies and legislation, and he'll talk a bit about this as well. Just briefly, I just wanted to, again, to just make sure you're familiar with some terminology when we come back to this. When we think about policy entrepreneurs, again, this is really from Kingdon, and just talks about the value or the role of people or groups being able to influence the policy agenda, being able to help mobilize individuals to really advocate for a policy, represents a particular group on policy issues. And again, we'll come back to this, but just wanted to introduce some of these terms. One other thing I want to remind you about is in this country, we tend to rely on incrementalism for policy change. And again, this has been present for a very long time. You look back at early literature for people studying policies for decades, since early 1900s, mid 1900s, where we look to see, well, how does policy change happen? And you think about this particular model of incrementalism, which was advanced by Charles Lindblom, that basically says that rational decision-making is really impossible for a lot of policy change due to how many different factors influence policy, right? So disagreement over objectives and not having enough knowledge and a number of other factors. And so what we see is that significant policy change occurs, if at all, through a number of small changes. And we'll talk more about this. And there are some exceptions to this. And I, one of the biggest ones that people think about is really the Affordable Care Act, right? That although there were lots of efforts to move forward big, massive federal legislation on healthcare, it didn't happen. It didn't happen through a number of administrations until President Obama was in office. I mean, this was really the biggest change we saw was around the ACA. And I think, one of the things I'll have you think about are other examples. Why it's important to mention this is just to know this is how change happens. This does not mean that we should not have a vision for the world that is big and bold, right? I tell people that incrementalism may be how the change happens, but that those changes will lead us to a long-term vision of a world that is more equitable and safer and healthier than it is today. So I don't want you to think that when we talk about incrementalism, that means you can't imagine things that are better. We'll talk in a moment about abolition and how does that interplay with policy. You can be thinking about abolishing systems and having a more equitable and just world. And the fact is that policies to get us there are rarely going to be something that's just going to happen tomorrow, right? There is this tendency to sort of chip away at these things over time until we have some big change. And so again, just want to introduce these concepts and make sure we're all on the same page, and we will come back to this for sure. I want to say a little bit about when we sort of think about the work we do in health equity and think about sort of more contemporary theories for policy making. I want to just, again, I won't say too much about critical race theory or intersectionality or abolition, but just want to make sure people are familiar with these terms, acknowledging that we have a lot of different disciplines in this space. And again, this is where I encourage you all to bring to this community any familiarity you have with these terms. And so maybe I'll pause and just invite anybody to share, if you'd like, how critical race theory or intersectionality or even abolition or abolitionist theory shows up in your work, if it is showing up in your work, or how you want it to show up in your work as you're moving forward.
I can jump off here. So one curiosity I have about exploring is the intersectionality of school and health professionals as they re-enter, specifically school and health professionals of minority or historically disadvantaged populations, and how they re-enter systems of oppression, such as educational systems. And what is it like for those individuals to go back into those same systems in which they had a hard time articulating through, and how does that inform the way in which they show up and advocate for their students in those spaces as well?
Mm-hmm. Thank you, Tevin. Thank you for naming that. Yeah, and I'll say, it's, in across our 4 years, there are people who are in the education space. And so I hope that you have a chance to connect with them too, and even share some of these perspectives. And there's a number of people who are doing work and thinking about intersectionality and even critical race theory. So thank you for naming that. I see Quetzalbel, your hand is up.
Yeah, so I think for me, I specifically want to look at intimate partner violence outcomes with Latino communities. And I think some of what I've seen in the literature is that there's a lot of explanation of we need more language services or a lot of acculturation theories, which I always think that there's a time and a place for those. But I think that what I really want to explore is for people that often have to rely on police to then sort of triage people to services for domestic violence survivors. What happens when you're someone with an immigrant status that could also then lead to deportation? So trying to explore the role of immigration policies and its effects both on IPV outcomes, but then even those predictors like societal factors that might also lead to instances of abuse.
Mm-hmm. Great, thank you for sharing that. Yeah, Ezekiel, I see your hand is up. I'm gonna turn the light on.
Yeah, as Quetzalbel was talking, it kind of reminded me, I think like in social work, we talk a lot about critical race theory. And so specifically, and I think some of the work that I try to do here, it's really more so focusing on sort of a branch of that called LatCrit, or like Latino critical race theory. Mm-hmm. And so I think to a lot of what Quetzalbel was just sort of talking about, like when I sort of apply LatCrit to my interest, which is really around like the labor exploitation of farm workers, especially here in the Southwest, like LatCrit for me sort of is a way of exploring how like the legal and institutional structures like really contribute to like racial and ethnic disparities. And so in the case of like farm workers especially, it's really examining like how immigration policies and also like labor laws and other sort of agricultural regulations really sort of create this environment that allows exploitation and unfair working conditions, especially when we compare, especially like farm work to other types of labor that are, a little bit more like blue collar or boots on the ground, I guess.
Yeah, thank you so much for that. And again, just hearing these two comments sort of the immigration policy, again, another area where there's a number of scholars doing work in this space that I hope that the session or networking, one of the sessions we're doing during the spring gathering is around sort of connections across disciplines and topics. And so I'm in the past, we've had people go into a Zoom room who are doing work in immigration policy and sort of connecting with each other. And so, and thank you for mentioning sort of other, not only thinking about Latino critical race theory, but also other aspects. And again, there are other people in our community who do work in that space as well. So again, I hope that you'll get a chance to connect with people. So thank you for naming that. I see Turquoise, your hand is up.
Yeah, definitely. I guess on that same note of working with critical race theory, but there's also tribal critical race theory. So what we call like tribal lit, or not tribal lit, tribal crit. And so it's similar, it primarily originated in education, but like in my profession is social work, I do work a lot in education, but working with creating spaces, and really just acknowledging that, from oppression and the hierarchy of racial statuses in our country, it definitely has an impact on access to education, and that has implications for policies not only at the institutional level, but I think at the federal level as well. And I guess in my experiences in my undergraduate research, the research that I did end up having an impact on a cultural leave policy at the University of Montana that then was adapted so that Native students, if they needed to leave for cultural reasons, they couldn't get penalized from it from professors in the institution. And so that really then created that, I guess, culturally relevant practice for the institution as a whole, which I think has a really big impact. And so you can see how some of these theories really can go, like you were saying, like through different disciplines, because they really do fight for the same purpose, I guess you can say.
Yeah, I appreciate you naming that. And thank you for mentioning also tribal crit. And I think, again, there'll be some space for other people who are using similar theories and perspectives on their topics to connect. This is something too that we'll do during the Summer Institute, where we have 170 scholars or so together. You can imagine there's lots of overlaps and opportunities for sharing and learning. All right. Thank you for those examples. All right. So let me hop back to this slide and say, just as you know, when I think about the work that I've done, particularly around racial equity, there certainly is a role for CRIT. As you think about critical race theory and health policy in particular, we see that there are individuals who bring this lens to thinking about policy development and implementation, and how do we center things like racial equity? How do we ask critical questions through a racially focused, decolonized, non-Eurocentrism lens, right? This is sort of how in practice these show up in the policy space. And we've seen examples of how, by being intentional about using a critical race theory lens for policy, you can really center equity in policy making. We are centering communities of color and other historically marginalized communities, and also helping to shift power through that intention of really supporting organizing principles for policy advocacy. And so again, we'll come back to this, but want to just remind people that I've met with scholars who've said, when I do critical race theory, how does that connect with policy? It absolutely can inform the work we do through an intentional lens, and through bringing these principles to how we engage in the policy process and how policy formulation and implementation moves forward. The other thing I want to mention is around abolition theory. And certainly when we look at the history of abolition theory, we sort of can look at prison abolitionists, right, who believe that really about incarceration harms more than it helps, and really about how can we have a society without prison. What I want to just mention is that when you read literature from abolitionists, abolition theory is not only about prison abolition. Like we think about the carceral system and abolition. One of the forefront writers in this space, Ruth Wilson Gilmore, says, abolition is really about presence. It's not about absence. It's about how do we build life-affirming institutions, whether it's education, transportation, banking, housing, whatever it is, like that's what we're talking about. So I encourage you not to think only about the carceral system or prison abolition, but it's about how do we construct a society without centering oppression and imprisonment. It's about dismantling institutions and systems to help people really live freely. And I love this quote, well, in terms of, as we think about what does this mean for the work we do, Dr. Bettina Love, who does work, who's an abolitionist, many years ago in an interview talked about how if we were to bring abolition theory to education, this is what the vision for schooling would be. And she talked about a vision for a school where there's no standardized testing, right? That there's no police, no metal detectors, that kids are showing up to school in a bright, beautiful building that is centered and where kids feel enveloped in love. That there are therapists and healers and counselors in addition to teachers, right? That we're not talking about suspension, that we're really talking about how we can have a holistic community institution that is about healing. And when she talks about how we can bring abolition theory to education, that's what she's talking about. And how do we use policy change to get there? Right. And so that's what I want to remind you that we're not talking about these discrete areas. There's connection, there's overlap. I've had people in our community say, well, I support abolition. I don't support policy change. I said, well, if we were to abolish prisons today, what would be there tomorrow? And how do we get there, right? Because the billion-dollar industry, it's not going to go away tomorrow. But could we use policy change to chip away at what's there, to get us to a vision of where we have different systems, we have different institutions? So I put that out there for you to think about, for you to respond to. And I just want to name that as we think about that lens and that vision, that it's not so separate from the kinds of things that are at the crux of this program. And when we think about policy, right? And I understand that policies have created a lot of harm. And I remind people, policies were created by people. Policies that create harm are created by people. So people can create policies that actually promote health and well-being and safety and healing. And I believe that, and I've seen that. And I've seen that happen at the local level, at the state level, certainly less at the federal level, but I want to name that it's possible. Turquoise, thank you for that book, and feel free to send me a note so I can lift that up. We can post it on the portal. Abolition and social work. Thank you. Yeah, that again, thinking about, well, how does abolition show up in social work? Talk about a sector that you can replace a lot of what Dr. Love said, and sort of think about different disciplines and talk about what is your vision for social work? One of the things that I'll say that often challenges us is that it's hard for people to imagine a world that they haven't experienced or seen yet, right? So the vision that Dr. Love was talking about, there's not many education systems, hardly any, maybe none. At the time, none when she mentioned this. This is right before COVID, right? That looks like this. And so part of what, when you talk with Jessica, we talk about vision, and we also talk about what is your vision for the world in terms of policy change. We're going to talk in our time together about what is the problem you want to address. So what is your vision for the solution? What is your vision for what the world will look like around that problem you want to address? And that's where we can say, well, how can policy help us get there? And so again, I just encourage you to think about that. And I'm naming that this is hard stuff. It's challenging. Sometimes it is discouraging, quite frankly, from my perspective, where I've been working on things and it just doesn't move. But the fact is that we can have a vision for a world that is free, that is without oppression, without harm, and that promotes healing and safety and beauty and love. And we can get there, and we can be thinking about how can we help our institutions to actually get to that place. And I don't say this because my vision, I don't believe that these things aren't possible. I hope I see some of these changes in my lifetime, but I know that the work we're doing collectively is planting seeds to help us get there. And then also too, I mentioned intersectionality and how we think about that. Again, I won't sit here for too long. We know intersectionality was a term coined by Kimberly Crenshaw, and that we think about the heterogeneity of different social groups and how individuals and groups are systematically marginalized in different spaces, places, and times. And then we also think about power indifferences and the power relations that impact all of that. And so I want to share that. I'm going to skip this a little bit, but when we think about health policy, it's how do we think about intersectionality showing up for health policy? Well, there are ways we can think about it when we think about what issues make it onto the agenda. How do we formulate policies? How do we implement policies? And how do we evaluate policies? And I want to share one particular framework that, let me pause and see if people have heard of the intersectionality-based policy analysis framework that has been developed that centers intersectionality, or people, has anybody heard of this? Anybody familiar with this or used this in your work? I'm not seeing hands here. I'll share one of my, I was on a dissertation committee for somebody who was interested in intersectionality, and I brought this framework to her, and she brought this to her dissertation research, where really thinking about, this is a framework from Havinsky, it came out in 2014, but really thinking about policy analysis through an intersectionality lens. And this is the model. And again, we won't sit here for too long, but we'll come back to this. But really thinking about how do we analyze policies through a lens of intersectionality. And so this particular framework, they have a number of questions in their article, and there's actually a whole white paper guide on this that really goes through how do we think about equity and social justice and reflexivity and power as we apply this lessons to this framework to analyzing different policies. Speaking of power, I want to just mention, well, how do we think about power in terms of the work we do for policy? Well, certainly, I think a more traditional approach is sort of the tension between policy makers and implementers, and so people in the community, where there's more of a top-down approach, right? Like telling people this is the way you're doing this. When we know in order to achieve health equity, to get to the types of society and community that we want, we have to build power and contest the power of those who wield power and don't refuse to give it up. And so we think about doing that through strategies like policy advocacy, organizing, voting, policy engagement. And again, we'll come back to these terms throughout our time together this spring. And also thinking about how do we use more participatory approaches to policymaking? How can we have a truly inclusive policy process where people feel seen and heard and where their voices are heard? And again, one way that we can lift that up is through voting. So I want to just share a couple of questions that I've been thinking about, particularly in terms of this session today. Would open it up to anybody's reactions, or to just ask what's coming up for you as you reflect on what I just shared, or what are some challenges in your work as you think about critical race theory or intersectionality or abolition when we think about policy. What are your thoughts about policy in terms of the context that I just talked about? And I'd love to just invite any reactions or thoughts. And I'll stop sharing, and that will be how we sort of wrap up our time together today. And I see your question, Shane. I will pose it. Maybe we'll start here with Shane's question. Shane, do you want to ask your question? Would you like for me to just read it, or what would you?
I'm happy to ask it.
Okay, yeah. Do you want to ask and share any thoughts, and we can see what your colleagues think too?
Yeah. Sorry also for having my video off. My parents live in a rural area, so if I have my video on, then Zoom just quits. So apologize for that.
No worries. We hear you just fine.
Perfect. Okay. So I was just wondering, as someone who has a storied history in policy work, right? I feel like there's often this sort of thread or this line that has to be sort of tread upon in some ways. And it's the idea that, we have to potentially work within systems that we know are maybe already harmful, but working within that system to try and affect potentially some kind of change, or trying something different that might also then put us sort of in harm's way as the advocate for something maybe radically different, like Dr. Love, was talking about in that quote. And so I'm just thinking about sort of like how personally you have sort of potentially walked that line, and I know a lot of this comes down to sort of like personal choice and how we decide to sort of go at the work, but just trying to think through some of that, like in the top of my mind, right? I'm thinking of like Dr. Gay at Harvard, and just sort of like the backlash and sort of the the ways in which people of color, queer people, right, when we're advocating or we're trying to be either parts of systems or trying to deconstruct systems, just sort of the ways in which that can put us in harm's way, and sort of just how we might manage that is just something that sort of continually exists in my mind.
Yeah, thank you, Shane, for naming that. I have some thoughts and reactions. I want to pause and see if any of your colleagues have some thoughts or reactions to what you shared. Let me see if anybody has anything to share, and then I'm happy to share my own experiences and how I've navigated this tension. Maybe I'll start by just sharing a few thoughts, and I so appreciate this question. There is a tension, and I will share. There's so much to share. I was on the first thing I'll share is I was on a webinar the other day. It was actually Sunday evening, of all times, and there were actually over 500 people on this webinar on a Sunday evening at 8 o'clock at night. And the webinar was called Say Her Name, and it was about harms in higher ed, particularly for Black women. And so it was about Dr. Gay, about other examples. Some of you may know that there were a number of Black women leaders in higher ed who have either one very unfortunate, prominent, tragic story of somebody who committed suicide due to the stress of the job and the harms that they were under. And there were other Black women leaders in the fall who also passed away, some believe due to the stress of being in these positions. And so I want to just name that yeah, for some, particularly for minoritized populations, some of these institutions that we are trying to change are harmful. They have a history of being harmful. They weren't created for many of us. I'm using the collective us, right? And so for me, and I can talk about that particular strategy from a department chair's perspective, being the first Black chair in my school. And I knew what that meant, and I knew what the harms of that were. And I decided, and I often take an inside-outside strategy to changing policies, where if I am in the institution, I seek to push to change, as well as working with colleagues and advocates outside the institution so that there's pressures coming from both ways. And so what does that look like for me? It's exhausting at times. I have a choice to do that, right? And it also comes down to personal preference and energy. A lot of the times I might decide, I engage a lot of times, and there are times where I don't, because I know it will be harmful for me, where I can't be, I think about, before I was chair, I was vice dean for faculty, and that most of my tenure was during COVID. It was as people were awakening to racism in light of the murder of George Floyd. And I cannot tell you how many people called and asked me to come to their department or group to talk about racism. And at some point I was like, I don't want to be teaching any more white folks about racism. I'm not doing that. That is exhausting to me. That is not helpful. And I named that, and that was important to me. And so I just say that to say there are times where we have the choice of how, I said earlier, how we engage is personal. And there are times where I tell people a story of when I went on visits on the Hill to work on SNAP, and Yui mentioned SNAP earlier. And there were some cuts to SNAP, and we were doing some Hill visits. And I walked into the office of a very conservative lawmaker and talked to his chief of staff about the work we were doing and about why cuts to SNAP would be harmful for people. It seems pretty obvious, right? Like, we're cutting people's food, and why would not be harmful? But this person was so fiscally conservative, they were just thinking about the cost savings. And so I had my one pager, made my pitch, and the person seemed to be listening, or they pretended well. And as I stood up to walk out of the room, before I even turned, that person threw my paper in the garbage. Didn't even wait for me to leave the room. And so in that moment, I thought, okay, there's a couple ways I could respond. One way is to let that New Yorker in me come out, and I wanted to curse him out, quite frankly. But then and I decided, in that moment, how am I going to show up? One, do I keep going and have these meetings that could also be potentially harmful in terms of my own confidence in the work I'm doing, the hope I believe in the system, and the fact that I can make a difference? Or could I could choose to also not engage? And I felt that I was willing to take the risk of having another person do that to me, because what I said mattered to me more than that. That is a very personal decision. I have colleagues who choose not to engage. I would say I also am self-aware enough to know my harms and my triggers. And I don't put myself in situations where I know it's going to be harmful in a way where I might feel actually unsafe as a person of color going into some spaces. But I just want to name and acknowledge this tension. But I find that the best strategies for policy changers are the ones that I'm doing with community, with people on the ground, to actually come and bring the evidence, to bring the resources with the individuals who've experienced or who have a stake in these policies, and coming together. And that's what I've been doing. So I hope, Shane, that just gives you one perspective on sort of how I acknowledge the tension, and it's hard. And sometimes I'm exhausted and I don't engage in a way that I would if I felt like I had more energy and was willing to risk, because it's risky too at times.
Thank you for sharing that. I don't want to speak for everyone, but I know in my own experience, I don't often hear that sort of transparency enough. So I just appreciate that real tension that is really difficult, and to know that maybe it doesn't end even though we advance our careers and experiences is not great. But I also think too, right, that there's, on some level, for me at least, what I believe is that sacrifice is part of some of this work in some ways, and also caring for ourselves. But yeah, again, just appreciate you sharing that and being transparent.
Yeah, you are welcome. That is one of my values, and I will share things. And I appreciate you naming that. And one thing that came up for me too in your response just now, Shane, is I feel very privileged to be in the position that I'm at. I'm privileged to be a first generation college, the person who's had the most education in my family, to be thinking about this, and the responsibility I feel to continuing to push even when it's challenging, to be that voice. And not everybody feels that way. And I want to name that's okay. We think about what is our role. I also believe that this is part of my purpose. And I really strongly, I grew up with a grandmother who always told me, you are here for a reason, you were made on purpose for a purpose. And I believe that. And so for me, figuring out what my purpose is, it's part of the reason why I'm in leadership in higher ed, because I believe that I can change. Higher ed should not be harmful. And I believe I can change higher ed so it shouldn't be so harmful. And that may be something that will never occur again in my lifetime, but I will keep working at it as long as I'm able. And so I think, figuring out what your purpose is, and how we can show up in these spaces and use the privilege that we all have. We have privilege as people getting our doctoral degrees or having the degree already. How can we use that to lead and create the world that we want to be in, and that promotes safety and health and well-being for everybody? So I want to just say thank you for those questions. Thank you for being here. I know that we're at time. Look how quickly time goes by. I want to thank you for letting me talk today and tell you a bit about my journey and story and how I'm in this space. I will be talking a lot less at our future sessions, but really just wanted to let you all know how I show up and how I come to this work. It is not easy. It is certainly a choice. And I'm here with you all to support you all and give you the tools that if you choose to engage in these various ways, you'll be equipped to do that. And we're going to expose you to some things through HPRS, and you can decide how you want to engage. So with that, I want to acknowledge all of you again, say thank you for being here. Thank you for showing up and being part of this community. I am so grateful. I missed you all dearly. And I look forward to seeing you again. Again, Jessica will be with us in a few weeks. She's looking forward to being with you all. Take care of yourselves. Reach out if I can be helpful. I'm always here just to have a conversation. So have a good evening, a good rest of your day. I will talk to you soon and see you soon.